Happy Saturday. Just got a couple hours out by the pool, so. Hey, what's up? Yeah, feel free to ask any questions you may have. I'll try and give you the best answer I got. New Orleans, that's a great place to have a conference. Hopefully you made it out to Bourbon Street. I'm actually from Louisiana, so hopefully you ate some crawfish. I saw some guy on here doing a crawfish boil live, so that brought back some memories. Hope you had fun. UNC Chapel Hill, what's up? How important is my team to me? Hey, what's up, Alden? My team is incredibly important. I hire people around me who help support me. The good thing is I'm in full control of my job, meaning I have power to hire and fire people that I don't enjoy working with. So that's a good thing about being in private practice. Everyone I work with supports me and does a good job with it. Graduating high school, just volunteer, try and find a mentor if you want to get into medical school. That's all very helpful. Thanks for the follows, thanks for the likes, thanks for all the support. If you guys have any questions, just drop them in the chat. Hope everyone's having a good Saturday. If you don't know me, I'm Dr. Harb. I'm an orthopedic surgeon, and I do a lot of minimally invasive and same-day hip and knee replacement surgeries. I'm in Washington, D.C. and Maryland area. Thanks for joining. Nice. Orthopedics is muscle and bone disease. So when you hear orthopedics, you may get it. Sometimes we'll say ortho or my ortho doc, and that's different from orthodontics, which is in the mouth. So orthopedics is taking care of patients with muscle, bone, tendon disease, but that's pretty broad. So yeah, it's not orthodontics. We're doing surgery on big joints, muscles and bones. We're the surgeons that take care of all the trauma that's not in the belly. So all the extremity trauma and spine and things like that. What's a typical day for me? Well, I operate 2.5 days a week, and then I have clinic 2.5 days. So I'm pretty busy, but my surgical days can start as early as 6 a.m. So, and then clinic, I usually start clinic on 7:30 on Fridays, but 8 a.m. on Tuesdays. Do I do ACDF? So I'm specialized in hip and knee. I've done ACDFs in the past. It's not something I do in my practice right now. I do orthopedic trauma that doesn't involve the spine, and I do mostly hip and knee replacements as well. Thanks for the likes. Thanks for the follows. Appreciate you guys. If you have any questions, just drop them in. I'll try and get to them. Will cement in a non-union tibial plateau. So if you have a tibial plateau fracture, you broke the top part of your tibia bone, we'll sometimes use what's called calcium phosphate, which is a specialized bone cement. We'll inject it in there. The goal is to remodel and create new bone with that specialized bone cement. So that's something that we're doing very commonly. It is called bone grafting, and we do it at the same time we'll fix a tibial fracture. How often do I work with kids and do scoliosis surgery? So, hey, what's up? So scoliosis surgery is usually so two types of surgeons do that. Spine orthopedic doctors will do that, and also there's some pediatric orthopedic doctors who will do scoliosis surgery. I've done them before. They're very enjoyable surgeries. They're fun surgeries. You take a kid with a crooked spine and you make their spine straight. So scoliosis surgery is really fun, and it's great when there's a good outcome and you have a kid with a straight spine. But I don't do it right now in practice. What's the best way to get rid of inflammation in the knee? So we approach the knee a couple different ways. We initially try to We initially tried to do conservative treatment, which is like anti-inflammatories, ice, bracing, therapy. If it doesn't get better, you can do injections, gel or cortisone injections. What's the craziest surgery I've ever done? So that's a great question. I've done a lot of crazy surgeries, and I've seen a lot of crazy stuff, but probably the tumor surgeries have to be one of the craziest surgeries. So this patient came in with what's called a basal cell carcinoma. Basal cell carcinoma is not a type of tumor that you usually have to, that invades, but this guy had this basal cell carcinoma for 30 years, and it had actually invaded into his scapula all the way. So in very, very rare circumstances, you can have invasion of it, you can have metastasis of this. So we had to take out his entire scapula. We left a little piece, but it's called a Hemiscapulectomy. So you're basically like taking out half the scapula. We had to take out his whole shoulder, and we left the rest of his arm and his elbow. So he basically had a floppy shoulder. He needed to get plastic surgery, skin grafts to rotate a muscle on his back to cover the defect. But basically he could still use his hand, but if we didn't do that operation, he would have basically had a mortality. It would have been a mortality if we didn't take it out. So that was a pretty crazy surgery. They do have scapula replacements that he could probably go on to get down the road, or some type of shoulder replacement, but that was just initial, getting rid of the tumor. Hey, what's up? Frozen shoulder, we'll sometimes do injections and therapy. Cortisone injections work great for inflammation and frozen shoulder. Is it easy to make friends in the career path? Yeah, some of my best friends are orthopedic surgeons or sports surgeons. I've made a ton of connections along my road, lifelong friendships. When you're a resident, you are working 80, 100-hour work weeks. And so you are stuck in the hospital full time with your brothers and sisters, basically. And you become really close with those people. So they are lifelong friends, and you make really good relationships along the way. So definitely. Total knee in October. Good luck. I have great guides and information on my website. If your knee's stiff, total knee replacement's a great way to help free up range of motion, break up some of the scar tissue at the same time. What age did I start? So it takes 14 years to become an orthopedic surgeon. You have college, you have medical school, you have residency, which is 5 years, medical school's 4, college is 4. There are some like expedited paths, but some people are even taking longer than that. And then you have a year of fellowship to do a specialization. Everyone's doing a specialization lately. And then you get out into practice. So it's about 14 years total. RN. Thanks for taking care of all the ortho patients. Did my relationship change after I became an attending? It's work-life balance, right? That's what you want to do. Luckily, being in private practice, I don't take a lot of call. I'm not rushing into the hospital for emergencies. With orthopedics, a lot of the times, if an emergency or a hip fracture comes in, I can usually take care of it the next day. So that's good for lifestyle and things like that. I'm also not too far away from my hospitals. It's only like 5-10 minute drive, so not bad. San Diego, California, beautiful. Probably the weather there is probably great. Orthopedic nurse, hey, what's up? Thanks for everything you do. How did I study for the Mcat? I did Princeton Review. I actually taught for the Princeton Review for a little while. I taught like physics for them, but I think everyone does one of those courses, Princeton Review or Kaplan, I think. It's been a while. The Mcat's changed since I had to take it. How long for shoulder connective tissue to heal? Well, it depends what's going on. If it's still bothering you after like 3 to 6 months, you may want to get an MRI just to look at the tissue. That can sometimes be helpful. Ortho x-ray tech. What's my biggest pet peeve with x-rays? It depends. If you're at an academic center and you're an x-ray tech, it's a lot tough because people are probably complaining about x-rays more because, let's say a resident wants an x-ray, they want the perfect x-ray. When you're out of private practice, a lot of x-rays are just good enough. So just shoot the views, shoot them as best you can. I don't have a lot of complaints when it comes to x-rays, as long as you're getting my views, getting weight bearing. And then efficiencies. We have an x-ray tech in our office. So, if I'm seeing patients in the office, I may have 40 patients and, they may have to do 2 sets of x-rays on a lot of them. So just be efficient and try and move things along, which is good. That's way different than a hospital setting. So where do I practice? I practice in Washington, D.C. and Maryland area. What did my parents do for work? Both my parents were in the casino business. They casino manager, director of a casino, not in the medical field. Do I use Conformis Implants? So if you guys don't know, Conformis is a company that gets 3D. You get a CT scan. It's a 3D printed, basically cutting jigs. And you apply those to the knee, and sometimes they're a little finicky and don't work that well, so I don't use it. Yes, I interpret my own x-rays. That's something I do. We shoot x-rays in the office, so I have to look at them. Orthopedic surgeons are just as good as radiologists at looking and reading x-rays, so it's something we do on a constant basis. Can a back fusion be undone? I would not recommend that. The problem when you have a back fusion is you put a bunch of bone graft in there, and with all that bone graft in the back, if you were to go in there and try and take it out and do like a lumbar disc replacement or something like that, that would fail. You would probably end up with like a foot drop or a neurologic injury, and that would create a lot of problems. I was a biological science major in college, but you can go any route. You don't have to go biological sciences. They like non-traditional routes. It almost makes, it sometimes even makes you more competitive by having kind of a non-traditional route. Thanks, JK Rav, if that's how you pronounce it. No, I have a lot of people who do telemedicine visits with me through this app. There's a link in my bio, and I've had people even fly for surgery. So I'm just on here to help people out as much as I can and provide a little education, have some fun while I'm doing it, and it's been enjoyable. What did I major in? Biological sciences. Lizarov frame, 6 months. Wow, that's a long time. Are they trying to do something? Are they trying to move your bones? Are they trying to get something to heal? It depends how messed up your fracture was. If it was really bad. I got a 36 on my Mcat. That was so long ago. That was like, I don't even know. That was like 18 years ago or something. Yeah, I am an orthopedic surgeon. I am a MD. You have to get your MD to become well, I guess you could be a DO, but yes, right here. MD, even though it's backwards. Yeah, ortho tech, anything in ortho is fun. I love being in the operating room. I do. So in my office, I have medical scribes. They chart everything for me. And that is really helpful. How do I manage infections in the knee? So the good thing with outpatient joints is it's a really clean facility at the surgery center. You can do an infection outpatient. You can wash out the knee and send them home the same day. But most of the infections I'm taking care of in the hospital, meaning, but there's very, very few infections after knee replacement surgery in the outpatient setting. So, but we wash it out. Sometimes we'll take all the implants out and we'll put what's called a spacer in, an antibiotic spacer. We'll give them antibiotics, and that helps to get rid of the infection. Do I put x-ray orders in, or do my techs do the charting? Well, in the office, I have a medical assistant and a scribe, so they're putting the x-ray orders in there. And then in the hospital, I have a resident and a physician assistant that work with me, and so they're doing the orders there. So as far as actually putting orders in, I don't do a ton of it. I have assistants to do that for me, and that way I can spend more time talking to the patient or talking to the family, which I think is time better spent. Complex regional pain syndrome is a tough one. You can do nerve blocks. Vitamin C can sometimes help. Nerve desensitization. I would probably see an IM or a pain specialist. How easy to find a job after residency? Well, you should probably do a fellowship after residency, and then it's pretty easy. I mean, any hospital system, finding a job and finding a good job are different. Any hospital system will probably hire you. So you want to find a good job. I did not get hired by, I had job offers to be hired by a hospital, but I declined them and turned them down, and I decided to go in the private practice setting, and it's been better for lifestyle, and it's good. I get to make my own hours and kind of run my own practice. Shoulder replacement, you could do an injection. That's a long time waiting. Are you not in the United States? Because usually the wait time is not that long for a shoulder replacement. Ortho removed a tiny bit of fluid and shot cortisone on my knee. Still feels the same. You could try gel injections, or maybe they didn't inject the right spot. There's a lot of, so when you're in medical school, you have to make a decision. The decision is, do you want to be a surgeon or do you want to go into medicine? And that's a pretty easy decision to make. You either like to do procedures, meaning you like to cut and do procedures and be in the operating room. If you don't like that, you go the medicine route. If you go the medicine route, you're treating a lot of chronic problems. As an orthopedic surgeon, I get to treat problems and they get better, and I can cure them and fix them. So the cost of an IM nail surgery in the United States, the cost varies. It depends on the hospital, it depends on the nail. But it's covered by insurance. If you don't have insurance here, you can get Medicaid. So most people aren't paying out of pocket for those procedures. How involved is my PA in my practice? Very involved. I do all my operations with her. She sees my patients if there's any issues and I'm operating. So she does a lot for me. I broke my ankle. I have plates and screws. It still hurts. Is that normal? A year and a half ago. After you break your ankle, you can develop arthritis. It's called post-traumatic arthritis. You can also have ligaments that may be never healed. So that can be, you can get an MRI to look at it. Sometimes there's not much you can do. Ankle replacement and ankle fusion are not always good procedures. You could sometimes go in with a camera and try and clean things up in the ankle. What type of medicine do I practice? I'm an orthopedic surgeon, so I do muscle and bone. I treat muscle and bone disease. And so if you break stuff, I fix it. Can you feel lightheaded during your first surgery? As a patient or as the doctor? You get used to these things after you do them so many times, and the patient's asleep on the table, so they're laying flat. Usually you don't get lightheaded when you're flat. What do you do for a hip patient hip pain that's lasted over 6 months and normal x-rays? You can get an MRI, check for a labrum tear. Labrum tears can cause pain in the hips. And that's one thing. Sometimes you could try an injection to rule things out. I often hear you have to be strong to be an orthopedic surgeon. It's helpful. It is, I'm 6'2". You're swinging a lot. You're swinging around a mallet. You're lifting people's legs. I've operated on people as big as 350 pounds. So it's helpful to be bigger. Do you have to be bigger? No. Are there women in orthopedics? Yes. You can use leverage to do anything. So, how many days a week do I work out? I try to work out 3 to 4 times a week if possible. Let's see. How long to recover from a hip replacement? About 8 weeks, but you'll make improvements even a year after the operation. I do what's called a minimally invasive direct anterior hip replacement. I think I have some videos on here showing it, but I do the surgery between the muscles, and it's a great operation. My question would be, are you having your hip replacement anterior or posterior approach? Thoughts on ROSA? I've tested it out. I'm not the biggest fan. Do you remove plates and screws after the bone is healed? So that's a good question. I would say probably 95% of the time we do not. Now, in some circumstances, many years down the road, the screws can back out. And then if they're painful, we will take it out, but it's very rare. A lot of scar tissue, it's hard. If you have a lot of scar tissue after an injury, there's not a ton that can be done. You can do massage, deep tissue massage can be helpful. If there's arthritis underlying that, that can be more painful. Sometimes you can do injections. How was your first surgery after residency? By the time you finish residency, you should know how to operate. You shouldn't be, you've done 5 years of operating, like you know how to do things. There's not a question. You're not like struggling to remember. And then you do a year more of training. So by the time you get out, you've probably done 2,000-3,000 cases. So it's not like you're trying to, you remember everything. It's like second nature. It's like putting on your pants. How many surgeries have you done in one day? I've done 8 joint replacements in one day. It's not my busiest day ever. I had a really busy day where I was on call and I did 13 surgeries in the day, but that was just because there was a ton of trauma that kept coming in. How many hours per week do you work? I probably work about 50, 55 hours a week. Not too bad. There's people who work a lot more, so. No, it wasn't, because I actually I joined a private practice. So by joining a private practice group, you usually have some time frame, and then you become a partner, and then you have all this autonomy. So it was a pre-existing private practice group. What do you do if you don't feel comfortable with your doctor? You get a second opinion. There's many doctors out there. You don't have to feel uncomfortable with your doctor. Just find a new doctor. Longest surgery, 16 hours. Psoriatic arthritis, it's an autoimmune disease. It attacks your joints and is very painful. I'm sorry you have that. That's difficult, very difficult to deal with. I've replaced joints on patients with psoriatic arthritis. Last year as a medical student, I mean, if it's your last year as a medical student, you're applying to residency, have as much research as you can. Try and have 4 to 5 publications if you want to get into an orthopedic, probably even more than that if you want to get into an orthopedic residency, and do really well on your step exams, but you've probably already taken those. So it's competitive. Orthopedics is probably the most competitive specialty. If I wasn't in medicine, I'd probably go into software engineering. I used to be really big into computers. I would program back in HTML and PHP back in the day. So that was like years ago. But I really liked the computer programming stuff. So I would probably go that route. I think that's what everyone's going now anyway. Everyone's trying to get into tech. But it's similar. Like in orthopedics, you're building stuff. In software engineering, you're building stuff. 45 days after a revision. I don't know. It depends what you had a revision for. That's a big operation. That's the goal. Get back to Zoom and get back to walking. It depends where you have the operation. My surgery center, it's about a 0.1% risk for an infection. So that's 1 in every 1,000 operations is a risk for an infection, which is that's much lower than the national average. The national average is 0.5 to 1%. What would be a reason that you do a posterior hip replacement? So my main hip replacements are anterior hip replacements. I will do posterior hip replacements in patients who are very big, meaning a BMI over 40. And anterior is just too hard in really big patients, especially really big muscular patients. And so, or a very big revision surgery. Those are the 2 times I'll do posterior, but most of the time I'm doing an anterior replacement. Like I did an ex-NFL player, I had to replace his hip. He was 350 pounds. He was like 6'8". I did a posterior hip on him and he did great. I'm just taking a quick, just answer some questions. If you didn't choose ortho, what other specialty would you have chosen? I don't know. It was ortho or nothing for me. I would have probably reapplied the next year and tried to become an orthopedic surgeon. So I set myself well up, though. I got a lot of research. I found good mentors. I did well on my board exams. And so those are all things that you could set yourself up so you don't set yourself up for failure. The average score, I think, is around 240 for the USMLE. I was around a 266 for my step score. If you're in the private practice sector, how would a pregnancy leave occur? So when you're in private practice, you collect what you make, meaning if you're pregnant, you take off, you don't get any money. You pay yourself. So if you're not working, you're not getting paid. It's not like you're salaried. There's no salary leave. So that's how it would work. It's tough, right? But that's owning it. When you're in private practice, you're basically owning and running your own business. If you don't show up to your own business, then you don't get paid. Why did I choose ortho? Because orthopedics, you get to fix people right away and they get better. It's not like you're treating cancer. It's not like you're treating long-term diabetes or blood pressure issues. You have a patient, they can't walk, they come in with a broken ankle or a messed up hip or a messed up knee, and you fix it. And they're back and they're cured after a certain period of time. And so that part is really good, and patients have pretty good results with hip and knee replacements. Is all of U.S. healthcare private? No. I would say actually it's becoming less and less private. There's private equity that are buying private practices. There's hospital groups that are buying private practices. So most physicians in the U.S. are actually hospital employed. Knee replacements are not dangerous. There are good result. There's good results with them, and they're very safe. Yeah, I love my scribes. My scribes make my life easier. They follow me around all day. They take notes when I see patients, and so they allow me to have a longer patient interaction time, which, in this day and age where there's so much electronic charting and things like that, it's really hard to, create that patient-doctor experience. So by having a scribe, I can spend more time with my patients, which creates a better relationship between us. So I think that's important. So scribes, I wouldn't give them up. They're great. Four weeks post-op total knee. Yeah, you're still very early. So keep working on range of motion, keep working with PT. I'm in Washington, D.C. and Maryland. Back surgery is tough. A total hip, a total knee, and back surgery. Back surgery is the tough. I think back surgery is the toughest, followed by knee then hip. Knees or hips the easiest, but back surgery can be difficult to recover from. How do I decompress after a hard day at work? I catch up on my stocks. I'm out of crypto, but check message boards. Check social media platforms. I go to the gym. I try to run. those are all decompression things. Hang out with my buddies, hang out with my friends, go for a drink. Can hardware in the ankle ever be removed? Yes, it can. If it's, yeah, we're actually, our office is actually hiring scribes. So if you know any medical assistants or scribes, or that's something you're interested in, there's a link in my bio with the office number, or you could just shoot me an email. We're always looking for new scribes and new medical assistants. The thing is, a lot of the scribes who come and work for us, they end up getting into medical school. So it's like this rotation of people coming through. So if you're interested, don't hesitate to reach out. Shadowing's hard right now, with all the COVID restrictions still. I know they're dying off, but the hospital hasn't changed at all. They actually just elevated their family restriction policy. So I wish I could have people shadowing me in the office again, but it's been a slow process to get back to that. But no, I really appreciate all the comments and all the support on here. Just trying to make educational videos, and it's been fun. I enjoy it. I enjoy the questions. I help people from time to time. I do telemed. We haven't, it's in-person shadowing is a lot different, right? If you do a telemed shadow, then someone's patient encounter could be recorded, and that could be a violation of HIPAA, and it depends what platform you're doing that through. So there really hasn't been a platform that's been developed for virtual shadowing. Now, will it be developed at some point? Maybe, but there's a lot of, for HIPAA compliance and things like that, there's a lot of things that are difficult to accomplish. Can an inflamed disc cause horrible pain in my thigh? Yes, it can. The hospitals here, so the Johns Hopkins system is not letting, at least in the hospitals, not letting anyone come in and shadow, and that's their personal restriction, nothing that I can do about. Yeah, being an EMT, I know a lot of people who were EMTs and they went into the medical field and wanted to and became doctors, so it definitely can. Complex meniscus repair therapy, January. You would hope to get more than 115. Depends, what was your replacement? What was your range of motion before, and did you have a retam? How do you feel about the recent hospital incident in Tulsa? So the recent hospital incident was incredibly tragic. It was an orthopedic spine surgeon who got killed, and I think it was one of his assistants, one of the patients who was in the waiting room with him, and then the receptionist. And it was a guy who had, it seems like, a pain after a previous back surgery, which back surgery is incredibly difficult. And it sounded like he got really frustrated with the doctor. Now, the thing that really upsets me with that whole situation is that I think Google had to block the physician's Google My Business profile because people were just leaving terrible comments after he wasn't even alive anymore. So I think that's crazy. It's just crazy, kind of the world where people think that's okay. And I'm sure that doctor was just trying to do the best for his patient. And some people are crazy. What's the best way to cure a pinched nerve? You can do therapy, anti-inflammatory. Sometimes we'll do injections. Yeah. I think it hits close to home for a lot of patients. It's not an isolated incident. I'm sure anyone who works in the medical profession has heard stories of a patient saying they were gonna create some active violence on a physician, or actually did. Like in New York, there were stories about, a patient bringing a gun into the waiting room, but these were like a long time ago. So there's been nothing recent. There should be security protocols in place where the doors lock, and things like that. So it's tough. Yeah, I think I read about the stabbing, but I was like, I can't read these articles anymore. It's just like negative article after negative article, and they should just have like a happy news feed or something, because it's just, there's so much going on in the world. Funny you pop up, I just fractured my distal fibula. Well, a lot of the times the distal fibula can heal on its own without surgery, so that can be helpful. Hopefully it's in a boot and you don't need a operation for that. Thanks for the follow. I appreciate it. Yeah, if you guys are tuning in, just feel free to drop any questions. I'll answer them. Total knee replacement, is it always the standard of a BMI of 40, or do some expect higher? Well, the goal is to get you under a BMI 40. 40 is the kind of relative cutoff. Now, not everyone can get under BMI 40, so I will operate on patients who are bigger than BMI 40, but we at least try to get them down. How do you even try to make patients happy? Like, can't you prescribe pain meds as they wish? I prescribe narcotics. I try to let my patients know, that narcotics have addictive profiles. They can suppress breathing. They can cause constipation. They can cause what's called opioid-induced hypoalgesia, where they actually cause more pain. But all of my post-op patients have the option to take opioids. Now, many of my patients will say, okay, you can prescribe me the oxycodone, but I'm not going to take it, or I'll give it right back to the pharmacy. But yes, all of my patients get pain medication. My practice is in Washington, D.C. and Maryland. I don't know an orthopedic surgeon, especially that doesn't give pain medication. Like, it's needed at post-operatively. You have to have at least have it available if you need it, because many people do need it. How much does an orthopedic surgeon work in a year? Well, you can work, it depends, but I would say most are anywhere from 40 to 70 hours a week. That orthopedic surgery is a growing field? Yes. We need more orthopedic surgeons. I will say, you had an accident in the military. Doctor told you were born with scoliosis. I will say that the majority of scoliosis is two types: congenital, which is less common, but it's called adult idiopathic scoliosis, meaning scoliosis develops when you are growing. You don't get scoliosis after you're done growing. The reason is because your spine growth plates are open, and so that spine can still curve. So scoliosis develops between 12 and 18 years of age. It doesn't develop with an injury. So unfortunately, I probably agree with the doctor that told you it developed or you had it early on. The male to female ratio, I think it's about 84% male in orthopedic surgery. Now, how much does an orthopedic surgeon make in a year? There's good numbers online. It's one of the higher paid specialties. It varies from region to region. It varies from subspecialist to subspecialist. And it depends how much you work, how much you see patients, how many operations you do. Both partial and full knee replacement surgeries have very good results. It depends which one's right for you. If you have wear or pain in other parts of your knee, or you have a big deformity, or you have a lot of stiffness, then a partial knee replacement may not be a good option. Are young dancers predisposed to developing scoliosis? There's been a lot of studies. I don't think there's no one profession that or something you do that makes you more prone to it. Some people just are at risk regardless of what they do, whether they dance or they don't. Would local anesthesia be possible for a partial ACL tear? Yeah, you could ask for a spinal anesthetic. That's definitely doable. Yeah, you can avoid general. Find a surgeon who will do it for you. If you do it at a surgery center, then definitely. That could easily happen. Scoliosis braces work really well. As long as your curve is under 40 degrees, that can be really helpful. I do knee revisions. I'm in Washington, D.C. and Maryland area. I do telehealth visits as well. I do take patients with Medicare. Currently, the practice does not accept Medicaid patients. Tethered spine is a very rare disorder. So I've maybe seen a couple, maybe like 2 or 3 over my career. So it's very rare. But I don't treat spine specifically, meaning a spine surgeon would see a lot more than those. But it's a rare diagnosis. May depend how did the total knee loosen within 2 years. It may depend on how it was put in, how it was cemented, what implant was used, if the alignment was good, and then some people just have poor bone quality, so it's hard to know. You would want to rule out infection for sure. But I really appreciate this. Thanks for all the questions. And I hope everyone has a really good weekend. Thanks for tuning in. I'll try and do more of these.